Hello everyone and welcome back to another anatomy video. This is Dr. Aiyan from the Veterinary Anatomy channel. In this video we will talk and dissect the bovine heart in details and talk about the main arteries coming from the heart. So let's get started. Okay, here we can see the heart located inside this sac here, the pericardium. So I am planning now to remove the pericardium completely. So before we do that, let me just remind you that the heart, this is the heart here located inside the pericardium. The pericardium itself has two layers. The outside layer here is the fibrous pericardium. This is the fibrous pericardium. And internally there we have the serous pericardium. The fibrous pericardium, as the name suggested, it has a lot of fibers, of course. The serous pericardium has again two layers. The layer which cover the sac from inside is the parietal serosa, and another layer cover the heart directly called the visceral serosa. There is another name for the visceral serosa called the epicardium. Again, this is the pericardium, surrounds the heart completely. It has from outside the fibrous pericardium, from inside the serous pericardium, which has again two layers, the parietal serosa and the visceral serosa. Another name for the visceral serosa is the epicardium. This shiny layer on the heart directly between the visceral serosa and the parietal serosa, this cavity called the pericardial cavity normally is filled with some fluid to reduce the friction between the heart and the sac and the surrounding structures. So I will remove the pericardium completely, and after that we can meet again. Look how big is it, surrounds the pericardium, starts from the base of the heart, from the origin of the arteries there, and cover the heart completely. So this is here the pericardium, and this is the heart inside it. So I will remove it and we will meet again. Okay, here we have the heart of the ox. Before we start talking about the details of the heart, let me just describe the heart in general. The heart has a base. This is the base of the heart where we have the main arteries. And we have the apex. This is the apex of the heart. The heart has two faces. This face here and the other face on the other side. And it has cranial border and caudal border. Again, base, apex, two faces. The one which we are looking at is the left face of the heart, or the left cervix of the heart. The other one is the right one. The left cervix of the heart, or the left face of the heart, called also the auricular face. Auricular face. Why auricular face? Because in this view, is the view where we can see both auricular cordis. This is the left auricular cordis and this is the right auricular cordis here. So in this view we can see both of them. That's why we will name this face as auricular face of the heart. The other face on the right side there called the arterial face. At that face we cannot see the auricular, but we can see the atria, both left and right atrium, and that's why we will name the other face as arterial face of the heart. The cranial border is formed completely by the right ventricle. The caudal border is formed by the left ventricle. In general, the heart has four chambers or four compartments. Two ventricles and two atria. Atria is plural of atrium. So here we have the left ventricle and here we have the right ventricle. Look at this. Actually, in the left view, we can see the right ventricle faces cranially or it's located cranially. So it's not on the right side. The same for the left ventricle, is caudally, located caudally, is not completely on the left side. So in the left view, auricular face, we can see the two ventricles, the left ventricle caudally and the right ventricle cranially. Here, I think you agree with me that the apex is formed completely by the left ventricle, while the right ventricle is located up here. If you look exactly, we will find a big groove at the level between the right and the left ventricle. This groove called, because of the location, the interventricular groove. On the other side, we have another groove located at the same level there. It has also the same name, interventricular groove, and that's why we can name this one as left interventricular groove. The other one is the right interventricular groove. Or there is another name for the left interventricular groove called the paraconal interventricular groove. Paraconal interventricular groove. The other one on the other side could be also called or named as subsinosal interventricular groove. If we dissect inside this groove here, we can find one artery and one vein. They have somehow the same. So the artery called also the paraconal interventricular artery. Paraconal interventricular artery or branch inside, of course, this groove. Here at this level, we have another groove called the coronary groove. This is the coronary groove, which is located exactly at the level between the two ventricles and two atria. At this level here, we have the coronary groove, where inside it, we can find the left and the right coronary arteries. In this view, we can see the left auricular cordis, and this is the right auricular cordis. Auricular cordis is actually an extension from the atrium. So that means the left auricular cordis is continuous there, or it's an extension from the left atrium. The same for the right auricular cordis comes from the right atrium. Caudally in this phase also, again, so we say here we have the paraconal interventricular groove. On the right side, we have the subsinosal interventricular groove. In the ox, we have another groove located caudally here. It's very developed and very clear in the ox, called the intermediate groove. Intermediate groove. So see how these grooves are filled completely with fat everywhere, especially the coronary groove, Here in this face, the auricular face, we can see some arteries here. The big one here comes from the right ventricle, the pulmonary trunk. This is the pulmonary trunk, which carries the blood from the right ventricle toward the lung. So at the beginning here, from the right ventricle, we have the pulmonary trunk, which will be, or which will give here, or which gives here two branches or two big arteries, as you can see, one to each lung. Here, from here, we will name these two arteries as the left and the right pulmonary arteries. So this is the pulmonary trunk, and from here we have the two pulmonary arteries. In this view, we can also see this very big artery here called the aorta. This is the aorta. The aorta, of course, comes from the left ventricle, and carries the blood from the left ventricle to the rest of the body. The oxygenated blood, to the rest of the body. From the left ventricle, again, there deeply, we will open the ventricle and I will show you exactly the origin of the aorta. Deeply there, from the aorta, the first two branches are the coronary arteries, the left and the right coronary arteries. The second branch is this big one here, which will move cranially. This is here the brachiocephalic trunk. The aorta itself forms at the beginning here what's called the aortic arch. This is the aortic arch, and after that it moves caudally inside the thoracic cavity. We will name this part here of the aorta thoracic aorta inside, and after that it penetrates, or go through the diaphragm to the abdomen, and inside the abdomen called the abdominal aorta. As I said before, the coronary arteries are the first two branches from the aorta to the heart itself. After that we have the brachiocephalic trunk, which will move cranially and gives inside the thoracic cavity the two subclavian arteries, and after that the two common carotid arteries. The subclavian arteries will give some branches in this area here, and finally they will move to the forelimbs. The common carotid arteries moves to the neck, and finally to the head. Here in this view, as you can see, of course, caudally and cranially, here we can see the caudal vena cava and the cranial vena cava. But we can see the veins more in the other view. So in the auricular phase, we can see more the arteries. We will move to the other side later, and you will see that in the right view, we can see more the veins, but not the arteries. Here, between the pulmonary trunk and the aorta, at the beginning here, we can see this ligament here extends between them. This is what's called the botalis ligament, or the ligamentum arteriosum here. It was before birth like a duct, of course, called the botalis duct, to transport the blood directly from the pulmonary trunk to the aorta. As before birth, as you know, the lungs are not functional, and there is no need to push the blood from the right ventricle to the lung, and that's why the blood can move directly through the botalis duct from the pulmonary trunk to the aorta, and from there to the body. Another system is also located inside between the two atria, called oval foramen, which serve the same purpose. Now we will move to the right side. So let's just rotate the heart like this. Yes, as you can see, we put something inside the veins and inside the arteries to fill them and make them like a little bit hard, to let you know exactly the position of these arteries and veins. So this is the right face of the heart. This is the right face. Let's just put it this way here. This is the aorta. So the right face, or again, if you remember, we said that we can name this face as arterial face. Why arterial face? Because in this face we cannot see the auricula, but we can see both atria. Here we have the right atrium, and there we have the left atrium. Again, in this face, we can also see the right ventricle located cranially here, and we have the left ventricle located caudally here. Okay, so the two ventricles, right and left. Between them, there is another groove. This is another groove between them, called the subsinosal interventricular groove, or if you forget this name, just say the right interventricular groove, where we can see inside it again one artery and one vein, the artery called also the subsinosal interventricular artery, which gives here ventricular branches to the ventricles for to supply them with blood. So subsinosal interventricular artery inside the subsinosal interventricular groove. What is the difference between this groove and the other groove? Go back in this video, you will find that the paraconal interventricular groove doesn't reach the apex directly. So while this one, if you follow it, it will go directly to the apex of the heart. So we talked about this is the right ventricle. This is the left ventricle. Here we have the coronary groove. Here we have the right, this is here, the right atrium. From the right atrium, we can see again the right auricula. This is the right auricula. And there we have the left atrium. This is the left atrium. Okay, good. In this view, the the arterial surface or arterial face of the heart, we can see these two big veins. These two big veins, this one here comes from the head, neck, and the forelimbs, called the cranial vena cava. This one here is the caudal vena cava. The caudal vena cava collects the blood from the caudal parts of the body, from the abdominal cavity, from the hind limb, from the pelvic cavity, and go through the diaphragm and finally to the right atrium. Both of them, they go to the right atrium. To the right atrium, they meet there and transport the blood to the right atrium. Blood from the veins to the right atrium, from the right atrium to the right ventricle, from the right ventricle to the pulmonary trunk to the lung. From the lung, the blood will be collected and comes back through the pulmonary veins, which we cut here to be able to remove the lungs. So here in the wall of the left ventricle, you will find a lot of openings here and there, represents the entrance of the pulmonary veins. This is all pulmonary veins to transport the oxygenated blood from the lung to the left atrium. From the left atrium, the blood will go to the left ventricle, and from the left ventricle, it will go through the aorta to the rest of the body. The right atrium receives also blood from the heart itself through what's called the coronary sinus, which collect the venous blood from the most of the heart itself. So, and it's located exactly there, Here, I would like also to mention that between the cranial vena cava and the caudal vena cava, inside the right atrium here, we have like a tissue called, which is formed from the dorsal wall here, called the intravenous tubercle, or a transverse ridge of tissue between the opening of the two vena cava, the cranial and the caudal vena cava. This tubercle or this tissue here is organized in the way that the blood coming from the heart and the forelimb or from the neck, it will be directed toward the right atrium. The same for the caudal vena cava. So the blood coming through the vena cava, so will be directed because of this transverse ridge here toward the right atrium. Here, what we've done actually, we cut or we open. We open the right ventricle, next to the paracoronal interventricular groove here completely. At the same time, we cut also and open the pulmonary trunk, as you can see. Why? It's just because I would like to show you the internal structures of the heart and the valves, which we can see inside the heart. So once we open this, as you can see here, firstly, let me just tell you that internally there we have what's called the ventricular septum. The ventricular septum is a very thick muscle, or muscular structure, located between the left and the right ventricle. This is here the interventricular septum. So now we are inside the right ventricle, and if you remember at the beginning of this video, we said that from the right ventricle, we have here the pulmonary trunk. So we opened the pulmonary trunk, as you can see here, to be able to see the internal structures. So if you allow me, in order to see other structures deeply there inside the right ventricle, including, for example, the tricuspid valve there, in this case, we have to cut this muscle, or this muscular fibers extends, between the septum and the lateral wall of the right ventricle, again from the lateral wall of the right ventricle to the interventricular septum. This is what's called the trabecula. The main function of this is to keep the wall of the right ventricle, close to the interventricular septum, and in this case it's like a continuous of the papillary muscle in the wall of the septum. So if you allow me, I will cut it now to be able to see or to describe the different structures inside the right ventricle. So we cut it, and now before talking about the tricuspid valve, let's look at this valve located in this area between the right ventricle to the pulmonary trunk. This is what's called the pulmonary valve. So what is the name of this valve here? Is the pulmonary valve. As you can see, this valve here, the pulmonary valve, has these three structures here called the semilunar valvula. These three structures, or what's called the semilunar valvula, located exactly at the beginning of the pulmonary trunk, they allow the blood to move from the right ventricle to the pulmonary trunk. At the same time, they prevent the blood from coming back from the pulmonary trunk toward the right ventricle, as you can see here. So in this case, the blood, if the blood moves from the right ventricle toward the pulmonary trunk, this valvula, so we name them valvula, semilunar valvula, will be just pushed to the wall of the pulmonary trunk, just like this, and allowing the blood to go to the pulmonary trunk and from there to the lung. The blood cannot come back, because once the blood comes back, this blood will fill these pockets here completely, in the way that they will close the opening between the pulmonary trunk and the right ventricle, and this, in this case, the blood cannot go. Let me show you this valve in this view here, in this view, like this. Doctor, I will take this one, and you will take the other two. Can you please? Thank you. So, as you can see here, the blood will fill these pockets completely, or this semilunar valvula completely, and there's no way for the blood to go back from the pulmonary trunk to the right ventricle. What is the name of this valvula? So we have three of them inside, to form this valve. We have the left semilunar valvula, we have the right semilunar valvula, and here we have the intermediate semilunar valvula. We have actually something similar to this between the left ventricle and the aorta, called the aortic valve. So to be able to see the tricuspid valve there, I would continue opening the right ventricle. So here I would continue on the way. We will see another some muscular fibers or muscular bundles between the interventricular septum and the wall of this is another one here, the wall of the right ventricle. So we will open the right ventricle completely here, and now we can see this valve there. Let me continue a little bit here. We can see this valve, called the atrioventricular valve. Atrioventricular valve, or what's called here in this situation the tricuspid valve. Why atrioventricular valve? Because it's located exactly between the right, in this case here, the right atrium and the right ventricle. And that's why we will name it also a right atrioventricular valve. Or in the book you will find another name called the tricuspid valve. Tricuspid because we have these three structures there. named casps. So we have 1, 2, 3, and that's why tricuspid valve. So this one next to the interventricular septum called the septal cusp. This one here is the parietal cusp, and this one here is the angular cusp. So again, that one next to the septum is the septal cusps, that one toward the wall is the parietal cusp, and that one here in between is the angular cusp. So tricuspid, that means 1, 2, 3 cusps. So the tricuspid valve, allow the blood to move from the right atrium there to the right ventricle. But after that, it will prevent the blood from moving from the right ventricle toward the right atrium. So if the blood wants to go back or to run back or to move back, in this case, the cusps will be also filled here with blood, and at the end they will be closed exactly this way here, that the blood doesn't have way to go back to the right atrium. To achieve this goal, you will find that each of these cusps is fixed to the wall of the ventricle, or exactly to a specific area, specific muscle found in the wall of the right ventricle called the papillary muscle. This is the papillary muscle. So the cusp is fixed to these papillary muscles by what's called the chorda tendineae. So this tendons here, all of these tendons called the chorda tendineae, to fix the cusps, to the wall of the right ventricle. So here we have the tricuspid valve. We will look at that one located between the left atrium and the left ventricle, called the bicuspid valve. Why bicuspid? Because here we have 3. There we will find that we have just 2 of such structures, cusps, and so I will open the left ventricle and come back to you. See you soon. So we are back. As you know, we opened the right ventricle. After that, as promised, I opened the left ventricle next to the paracoronal interventricular roof. So firstly, let me show you that this is here the ventricular septum. This is the ventricular septum. It's really very thick. Okay, so now we are inside the left ventricle. Again, here we can also find some of the trabecula here extends between the septum to the wall of the left ventricle. This is all trabecula, just to fix, the wall toward the heart, I will cut all of them later to be able to show you some of other structure. I opened also the aorta at this level. So the aorta, as we explained before, starts from the left ventricle. And as described, we said that between the left ventricle and the aorta, we have another valve. This one here. It has also 3 valvula, semilunar valvula, 3 of them. We have the left, the right, and the septal valvula. So this is 1, 2, 3. So they form together what's called the aortic valve. So this is here the aortic valve. Exactly in the same way we described before. This allow the blood to move from the left ventricle toward the aorta. As you can see here, once I put my hand here, I will push this valvula to the wall like this, so allowing the blood to go to the aorta. After that, if the blood want to go back, in this case the blood will fill completely. So can you take this too? Yes, please. Yeah, the blood will fill completely this valvula here, and this will close the opening between the left ventricle and the aorta. So what is the name of this? Between the aorta and the left ventricle, the aortic valve. Let's stay at this level here. I will show you, as I told you before, that at the base of the aorta, here we can see the two openings to the left and right, coronary artery. So this is one here. I hope it's clear. This one here. This is the right coronary artery. This is the right coronary artery. And we have another one here. This is the left coronary artery. I will show you. So this is the opening. Yeah, in one view, you can see the opening of both coronary arteries. This is the right coronary artery, and this is the left coronary artery. What's happened if you put something inside this coronary artery? For example, once we cut actually the connection or open the ventricle, the left ventricle, we cut, of course, or we went through the coronary groove where we described that we can find the coronary artery. This is the left coronary artery moving inside the coronary groove. So let me just push this way here, and this is how the coronary artery moves inside the coronary groove. It was like this exactly, we cut it in the middle, and as you can see, the left coronary artery is responsible to supply the left ventricle. In this case, has its opening from the aorta at this level here after the aortic semilunar valve. Directly, if we follow the aorta here, we can see the second, after these two coronary artery, we have this very big opening. Look, I can put two fingers here. So here we're talking about the brachiocephalic trunk, which is responsible from the name brachiocephalic. Brachio from brachium for the forelimbs, cephalic for the neck and head, This is the brachiocephalic trunk, and after that it moves, caudally to supply other, the rest of the organs and muscles in the body. Okay, let's go back to the left ventricle. And as I said before, I would like now to show you the bicuspid valve. Perhaps I can keep this here, but let me just cut this one here, and I will try now to show you the two cusps of the bicuspid valve. So this is one, and that is another one here, if you can see it. Okay, so we have just two cusps here. The septal and the other one here, the parietal. The septal toward the septum and the parietal toward the wall of the left ventricle. Okay, so just two cusps, and that's why we will name this as bicuspid valve. So bicuspid valve. So let me cut this structure here. This is one of the chorda tendinia. So let me cut it. Chorda tendinia, very strong tendon to hold the cusp, to the wall of the ventricle, and exactly where to what's called the papillary muscle. This is the papillary muscle. It's a big muscle found in the wall. Here we have one, and here we have one. I will just cut one of these chorda tendinia. It's really very hard even to be cut, And after that, I will just separate it here and to show you exactly, the opening here, between the left ventricle, left atrium and left ventricle. In the same way, exactly in the same way, here this valve is responsible to allow the blood to come from the left atrium to the left ventricle, but at the same time to avoid the blood from going back from the ventricle to the atrium. So comes in, but it's not allowed to comes back. Comes in, not back. In, not back. Okay? And all of this again, what is the name of this? Strong tendon, chorda tendinia, to the papillary muscles. I hope everything is clear now. So here once again we are inside the left ventricle. So we open the left ventricle here at the base of the heart, between the aorta and the left ventricle, in the wall exactly there. We can find like a fibrocartilaginous structure in all animals, but here especially in the ox, this fibrocartilaginous structure is very developed and it forms what's called the oscardus. So it's a bone actually found in this area. I just tried here to show you the bone by removing some of the soft tissue surrounding the bone. So as you can see, we can find this bone at the base of the aorta, inside the wall and inside the septum. Inside the wall and inside the septum, the wall of the left ventricle and inside the septum. And this bone will support the opening to the aorta, will support the aortic valve. So as you can see, we can palpate this bone in the wall there. So I just dissected part of it here. This is the bone, the oscardus, and we can palpate it at the base there. And also it's very strong actually in the ox here at this level here. It's somehow rounded. It moves into the ventricular septum in the way that we can even palpate it from the right side inside the right ventricle there. I can palpate it with my finger there, so that means it supports also the right atrioventricular valve, or what's called the tricuspid valve there. This is here what's called the oscardus, very developed in the ox and even the camel.